And with that, I yield to a gentleman who spent much of his career understanding the insurance industry in his state and around the country. I yield to the gentleman from California.
Thank you, my colleague. I look forward to your continued pushing of this issue. It was a century ago that Teddy Roosevelt established the progressive effort to push back against the rapacious greed of Wall Street and those who were raping the American environment, and began the progressive movement. Competition was at the heart of that effort to bring about justice and an opportunity for the small guy to actually make it. Right now, here in Washington, those of us who care about individuals, who care about small business, who care about the future of this economy, are pushing back against those very same forces who over the last 65 years have been able to embed themselves firmly in the American system in a way that has created greater profits for them at the expense of people. The health insurance industry has clearly put profits before people, and it's time for us to end that. With this bill, we forced that industry into the same market that we want all of American industry to be in. That is in the free market competitive system, and to no longer be able to monopolize the health insurance marketplace. Let me give you an example of what happens in California, where WellPoint, Blue Cross of California, has 80% of the individual market. Last year, in 2009, they raised their rates an average of 30% in that individual market. The result of that was that their fourth quarter profit, year to year, 2008 to 2009, increased some 700-fold, from $300 plus million to over $2.7 billion. How did they do that? They did that by controlling the marketplace, having a virtual monopoly on the market. Now, that wasn't enough for them. Because of their market control, they have been able to institute, although it's been delayed, a 39%, up to 39% and a 30% average increase in this same marketplace. It is time. It's absolutely essential that this two-page, 24-line bill that establishes the antitrust law in this field of health insurance be enacted. Later, when we come back around with another comment, I'll tell you how it worked in California in 1991 when we instituted Proposition 103 that eliminated the ability of the property casualty market, automobiles, homeowners, similar products, eliminated their ability to monopolize and to take advantage of being outside of the antitrust laws. Let me congratulate you and your colleague and our colleague from Colorado for putting forth this bill. It is essential.
Not to jump to the end of that story, but before we go on, I do believe when you instituted those reforms in your state, the premium rates increased at 1/10 of the rate of the rest of the country. Is that correct?
Well, what happened in Proposition 103, and I was the newly elected insurance commissioner in 1991 responsible for implementing the law, the insurance industry had the ability to work together to set rates and to monopolize the market in a way that was in a pattern to be able to have a uniform rate system using what was called rating bureaus. We simply outlawed rating bureaus and forced each company to use its own statistical analysis to set rates. The result was, over a 10-year period, $30 billion reduction in cost to homeowners and automobile insurance consumers in the state of California. I will tell you this, when you force these companies to compete, when you eliminate their protection from the antitrust laws, you will see a significant rate decrease. And when you have a company such as Blue Cross that dominates a segment of the market, that is what is outlawed under the normal antitrust laws of this nation. Well, there is absolutely no doubt that it's an axiom of American business and the American economic system that competition leads to Good things, lower prices and better product. But in the case of health insurance, as we've seen over these last decades, we've seen an increasing concentration and less competition. This bill will put competition back into the health insurance sector, and it is desperately needed. Right now, in California, with Blue Cross of California, where they have 80% of the market, they don't need to compete for the customers. The customers are desperate to get coverage, and they got to take whatever is being offered by a company that has 80% of the market. So let's get some competition back in there. This is also an issue that affects individuals. I know a 23-year-old girl who's no longer on her parents' health insurance, cannot get health insurance even though she's applied to Blue Cross because she had acne. And the list of pre-existing conditions are 3 pages long. So if we have competition by eliminating this antitrust exemption, enforcing and ending the monopoly, then I think companies are going to have to go out and search for customers. And that would help us all. And let us also be very, very aware. I've spent 8 years of my life regulating the insurance industry. And I know this about that industry. It's about profit. It's not about people. Now, in the property casualty business, it's important to pay attention to people, but it's not life or death in most cases. In the case of health insurance, it is about a human being's life. It's about the young lady that I saw at a town hall meeting this last week, a 12-year-old girl born with a heart condition whose father cannot leave the job, cannot go to a better job for fear of losing his health care. Knowing that if he lost his health insurance, this young lady would not survive. She would lose her life. That's wrong, and that's got to end. This bill is one small piece of the larger puzzle that we're working on to put in place in America a health care bill where people come before profit. We can do that. We can do that with this bill, and it'll be very clear in this House tomorrow where we stand. Do we stand with families who need health care? Do we stand with individuals? Do we stand with young Gloria and her parents and say, end the monopoly? Put the antitrust laws in place so that the health insurance industry has to compete. That's our choice. And we'll see tomorrow where we stand. Do we follow the tradition of Teddy Roosevelt, a Republican, who went after the big corporations and said that in America competition must be there, who fought back and pushed back against Wall Street? Or do we stand with the health insurance industry? That's our choice tomorrow, and it's there because 2 members of this House have put forth a bill. My colleague from Virginia and my colleague from Colorado, and I thank you for bringing this before us so that we can identify with the individuals who need health care, or, on the other hand, with the insurance industry.